back. This is Boomer Life on CL650.
Spinning round and round. Oh my gosh, it's Boomer Life on CL650 with the Dizzy Doctor. We're talking, of course, with our friends from Neurokinetics Clinic in Vancouver. Doctor is Philippe Silvestre. Sonia Dale is the clinic manager. JC Gordon is with us for the first time. JC is Director of Liaison and Logistics. Dr. Philippe, we were talking about, we're talking on this episode of Boomer Life a lot about balance and dizziness issues. And you mentioned during our little time out here, and we're going to go back to Sonia's explanation of the process, the intake process, but you also mentioned something about a timeline. That a person, because we've identified the fact that through JC's help and others, that Neurokinetics is for many almost a clinic of last resort. They've been to everywhere else. They've received very limited satisfaction, and they're just frustrated beyond belief. They find Neurokinetics, and they get something done. So, but Philippe, you talked about a timeline. If someone is dealing with dizziness and balance issues, disorders, how long a timeline are we talking about before someone really needs to do something important?
I would say 6 months.
6 months of what? 6 months of recognizing this imbalance in your life?
No. No, it's more about doing whatever can be done according to the mainstream, mindset.
Oh.
Medical mindset, I mean. Whether with using Western medical competencies or expertises or Eastern medical expertises.
Oh, I see.
Yeah.
So after 6 months
of trying
somebody's remedy,
if this doesn't work, there is no significant results. And by significant results, I mean on a scale from 0 to 10, where 0 would be normal, and 10 normal or excellent, and 10 being you cannot hang or even holding on the wall and you fall each time you move a finger.
Right.
That would be the 10. Then, I mean, norms would be between 0 and 2,
Right.
Yeah.
Okay. So back to the process, because this is intriguing. Philippe, you were talking about some of the testing that gets done. And there were 3 after the initial come on in and have a chat with us meeting that Sonia, you talked about earlier. Then they come in for the first of 3 assessments. And those assessments, each session can take hours in some cases, right?
They can, yes. They can take up to about 4 hours.
Okay.
Yes.
And Philippe, you've already identified a balance test as being an integral part of the first of the 3 sessions. What other testing, sort of standard testing, do you conduct, particularly in that first session?
Okay. Our assessment includes 2 components, to keep it simple, 2 components. The first component would be investigative, which means it is about talking, conversing, discussing about the patient's history, whether medical, whether trauma history,
right,
lifestyle history, occupational history, and so forth, and also reviewing the current status of symptoms and incapacitation, and as well, and medication to be taken at that time, if any. And the other component will be to assess this patient in a sensory deprived environment, which is a specialized calibrated environment in which we can read at once a formidable amount of data which are recorded and measurable.
So you put a person in some kind of isolation chamber of some kind and wire them up? Is that how it goes?
Yes. We don't electrocute our patients.
Darn sporting of you, Doc.
No. We care for them. So we won't ever do that. But we lightly wire them.
Right.
We certainly film them, take pictures from any angle we can, and the process lasts from 45 minutes to 1 hour.
Okay. And that's in the first of the 3 assessment moments, right?
Not only. We repeat this pattern during the 3 sessions. So as Sonia mentioned, the minimum time of such assessment, including both components, I mentioned investigation and measurement,
right,
collection, would take about 4 to 5 hours. So I need to spend a minimum of 12 to 15 hours with a given patient, plus personal time, let's say about 1 hour on the top, 1 to 1.5 hours on the top of every session. So that means 3 times 1.5 hour max. You name it, it's 4.5 hours. So it will take about 18 to 20 hours of work before I dare beginning a treatment program, which is nothing else than a treatment strategy.
Okay, so after roughly 20 hours of examination and preparation, then you are prepared to design a strategy for that person.
I know what to do. Exactly.
Okay.
And I will know the outcome before starting the treatment.
Okay. And does the patient get included in these conversations all the way?
100%.
Okay. JC, you want to jump in on this one?
Yeah, the initial assessment that we do, Sterling, with every patient that comes to see us is to determine if what our specialty does is going to be able to help them.
Sure, of course.
And after we've determined that, we then are able to measure the intensity of the program that would be required and the duration of the program that would be required. So before Dr. Philippe begins any treatment, we know A, we can help, B, what the intensity of our involvement will be, and C, the duration of the involvement.
Right, okay.
So before any treatment is done, our patients know exactly what is going to be coming at them and what is going to be the results.
And I would like to complete, thank you, Jesse, for mentioning that. The most important parameter I rely on before initiating a treatment is I need to know to which extent the outcome will be. I will never start a treatment program if I don't know we got at least a significant amount of recovery.
Okay.
And I know that before starting the treatment.
Okay. Yeah. Sonia, you mentioned something a few moments ago about the necessity for the three times process and the evaluation intake.
Yes.
And you said it has to do with the human brain and its ability to retain information. Tell us about that.
Well, a lot of patients, when they do call in, they said, why do you guys always do 3? The best way that I can explain to them, I would say, is simple thing as even driving. If you're driving a certain direction, you can train your brain, it will remember certain things. This is where I was for a certain amount of time. But if we have, or if we're not well, there is a time where you won't remember. So there's a reason why we do 3. We do the first one, you're going to get the results that we need to get from that person because A, they're not well and they've come in the first time. Second time around, your brain will remember and said, hey, I've done this before. I just did it yesterday, no problem.
Right.
Third time, you're going to go back to the first day information and maybe if not even worse, because the whole information we need to collect from all 3 of them, collect the data and say, this is what the customized program is. This is why we do 3 of them, because you can train your brain a certain way,
right,
but you can't confuse it or train it, repeatedly at a time if you're not well.
Okay,
that's a very interesting dynamic at play there. Philippe, you wanted to jump in too.
Sonia has just hit the nail on the head.
Okay.
Thank you.
I would like to add just a little things as seen from my standpoint. We need one session only performed at any time would be seen as a snapshot on a condition.
Right.
We have this expertise is a result of many studies. You guessed that. It is. I am in my 34 years of career in that business. So when I began to be involved and understood the need to develop such expertise for extremely severe chronic conditions and trauma conditions, I understood very quickly that cognition is extremely volatile in a chronic condition as well as a severe post-traumatic condition. And because of that extreme volatility, which is instability in a cognitive processing,
right,
one session, one assessment only will not lead to any conclusive information.
Right.
We need 3. We have tried up to 12 repeated sessions.
Interesting.
He boiled down that 3 are enough. It is the effective minimum number of sessions we require to come up with reliable interpretative data, which will give us help us to foresee and forecast a potential degree of recovery available at a given time in a given condition.
JC described when you've reached your conclusions after the assessment process has been completed, and you sit down with the patient and you discuss, okay, so I've designed this program for you, and it's going to require your being here and participating to this extent. Obviously, you need to get the cooperation of the patient.
100%.
Typically, though, Philippe, how long and I don't suppose there is a typical scenario, but how long might one expect to be in treatment for something that they've probably been suffering from for a good long time?
Yes, sometimes for decades.
Yes.
It is not uncommon to have patients who have gone through this lingering condition for 1, 2, or 3 decades. It is not uncommon. And this is the type of patient we receive. To answer your question in short, there's a minimum duration of treatment which can be extended as needed and according to the complexity of a given condition.
So what would the minimum then be?
12 weeks.
Oh, okay.
This is a paradigm which has been now published upon increasingly over the past 4 to 5 years. It's really recent. I have identified these paradigms 28 years ago. And this is a part of the characteristic of such a treatment program. 12 weeks minimum relates to brain physiology. It is a brain physiology paradigm. It ties with the cognitive controls as they work and support the sensory motor control. So it is hardcore neuroscience.
Right. So in that 12-week period, how frequently would a patient or should a patient expect to go to Neurokinetics for those treatment sessions?
It is highly variable. As the common pattern I can describe in simple words is the leverage of the healing momentum which we look for will require a high number of stimulation at the beginning of the program.
Oh, so more upfront than as you go along.
Exactly.
Okay.
And the number of sessions will go decrescendo as we go through the program following the recovery and the recuperation of capabilities from the patient standpoint.
And do some patients require or request perhaps an ongoing sort of maintenance program where once every 3 or 6 or 12 months they come in for a visit and a kind of an upgrade, if you will, or maybe just a little morale booster?
Yes. The short answer is yes. This is highly variable. It is people's choice in the first place.
Of course, yeah.
Or sometimes they feel good enough and they won't have the desire or the need to come to see us. Sometimes some patients will come for a tune-up, as we call it.
A tune-up, exactly, right.
And also we use a number of ambulatory stimulations. Patients carry on with them. And the further extent of the lifespan of one of those stimulations is at most 1 year. So some patients will come every year to be tested to see if they still need such a stimulation, and if they do, they will opt for taking it or not.
There's some that do, going back to what Dr. Philippe is saying, there's some that just come in, as you're saying, 6 months or a year, just come in to say, to enhance their performance, as we call it.
Just checking in.
Just checking in, hey, tune up, as he's saying, and just to enhance the performance, just to get them back to, or give them an extra little bit of a kick back to, their life. So
a number of corporate executive, and professional athletes are coming regularly for enhancing their performance. You can consider, we are as JC explained at the beginning of this hour, we are in a peak performance business. So it's not only about recovering and resetting brain and recovering capabilities and potentials. It is also tuning in and enhancing these potentials, even once healthy.
JC?
When our patients, Dr. Philippe has completed the treatment program, we always make sure that our patients have ongoing support away from the clinic 24/7 with some of our proprietary protocols that we leave with patients, so that when we get our patients back to their optimum peak performance, that's not the end of the work that we do with them.
Right.
We are with them on an ongoing basis, even after they leave the clinic.
Right. Interesting stuff, and good a model too, a good therapy model as well. So I need to take a break. Our producer is having a kitten in the next room, so we better put him out of his misery here. When we come back, you've heard, of course, about the mission to Mars. Have you received your invitation yet? Well, guess what? One of our guests has. We'll tell you all about it after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIAL 650.